The Chief Medical Officer, Paul Kelly, joins us now from Canberra. Professor Kelly, good morning to you.
Good morning.
So we've gone from Australians being at the front of the queue to all Australians being fully vaccinated by October to Australians receiving one dose by October to now no targets being set at all. Can you understand why a lot of Australians are completely unsettled by all this?
So I would say that we are continuing with our rollout. That's continuing to expand. We'll have more than 4,000 GPs, GP respiratory clinics and Aboriginal controlled centres vaccinating this week. So that's quadrupled in the last month. We're continuing to work with the states and territories on their rollout, as well as our aged care rollout, which is coming close to conclusion. Disability is included in that 1A and 1B targets. So we're going to that first step was always to look at covering our vulnerable and those most likely to be exposed to the COVID-19 virus by the middle of the year. That's continuing, and of course the new information, that safety information that was given to us last Thursday night, has led to a re-look at the other plans for later in the year. But on the other side, we've got that announcement of 20 million more Pfizer doses. So we're putting that all into the mix, as we've always been throughout this entire pandemic. We're nimble in relation to new information as it comes by, and sometimes you get these curveballs, and you just need to deal with them.
Yeah, absolutely.
Over the last few days.
I hear you, but it is quite the curveball, right? And Australians, again, I'll ask the question, would have read the Prime Minister's statement on Facebook last night and pondered, well, we might not get vaccinated until well into next year.
So we have the aim of offering the vaccine as soon as possible to as many people as possible, and that remains the plan. I guess what the Prime Minister's statement last night was to say, look, just wait. We'll be working through that, and there'll be more information about this as we go forward. But that different advice does change the way we were planning to roll it out, and we just need some time to work through that. But in the meantime, I was talking to a close friend of mine who's a rural GP over the weekend, and he understands what this means and what he'll be saying to his patients this week as they roll up. He's part of an AstraZeneca clinic in a rural area. I spoke last night with many people and many colleagues over the weekend, and including many friends that are over the age of 70. They're all going ahead and getting that AstraZeneca. They understand what the message was about in terms of that balance between risk and benefit. My own uncle had the vaccine on Friday with his wife, and the AstraZeneca vaccine, and they're in that 1B group. So
but I guess,
will continue.
Excuse the interruption. I guess we wouldn't be in this situation if the government, going back into next year, did what a lot of other countries have done and hedged their bets by trying to secure deals with other vaccine makers, including Moderna and Johnson & Johnson.
So we've now got locked-in, absolutely guaranteed deals with Pfizer and with AstraZeneca for 170 million doses, if you include also the COVAX possibilities, but which is way more than we need for Australia, and it will allow us to consider what we can do in our region. And that was the other announcement not many people are talking about today, but very importantly that we are guaranteeing vaccines into our Pacific neighbours. So we've got plenty of vaccine. Having extra arrangements is not necessary. We will have by the end of the year.
We haven't got
40 million.
The 20 million extra Pfizer doses. I mean, the Prime Minister said they were secured. They're not really secured, are they, until they arrive in this country?
Look, the international supply is always uncertain, but I think if you look at what's happening in the rest of the world, I'm sure that Pfizer, and they've guaranteed to us that they will have that extra 20 million and the rest of the current 20 million here by the end of the year. But it will be back-ended at the end of the year, it's true. The one thing we do have is that local supply of AstraZeneca. And remember, we also have the Novavax supply too. When that comes through, that will be available.
Just before you go, we had Mary Louise McLaws, who you know is a prominent epidemiologist, a member of a member of the WHO's expert advisory panel. She was on the show earlier, and she says it's her view that unless Australia ramps up daily vaccinations to 100 to 120,000, the latest tally is 27,000, unless we ramp up to as many as 120,000, it's going to take 2 years for all of Australia to be vaccinated. Is she on the money?
No, she isn't. And so I think if you really looked closely at the data of the rollout so far, this is not a straight line. It is an exponential curve, and we were really right now on the very large increase in the daily doses. Of course, we expect that may well take a knock as people look at and sort of think about what that announcement was last week. But I would say a couple of things on that. Firstly, we've quadrupled the number of GPs that are rolling out the vaccine. We've quadrupled the number of doses that they are rolling out over the last few weeks. And even on Friday, Thursday and Friday were record days in terms of the GP rollout. So that will continue. And anyone who's who wants to think about taking the vaccine, that are in those groups that we're really prioritising at the moment, should continue to do that. Go and talk to your GP and consider the risk and benefit for you in relation to this new information of this rare but serious clotting issue. And let's keep going. We need Australians to continue to roll up their arms and take the jab.
To roll up and get injected. Paul Kelly, Chief Medical Officer, thank you for joining us. We should point out to our viewers, we did ask the Health Minister, Greg Hunt, to come on and answer questions. He was unavailable. We really appreciate you stumping up instead.
You're welcome.